121. A patient with sickle cell anemia is prescribed oxygen therapy. What is the primary purpose? A. Reduce pain. B. Improve oxygenation. C. Prevent infection. D. Enhance platelet production. Answer: B. Improve oxygenation. Rationale: oxygen therapy, B, improves oxygenation in sickle cell anemia, addressing hypoxia from vaso-occlusion or anemia. It does not reduce pain, A, prevent infection, C, or enhance platelets, D. 122. A nurse is assessing a patient with suspected von Willebrand disease. Which history finding supports this diagnosis? A. Prolonged menstrual bleeding. B. Occasional headaches. C. Mild fatigue. D. Dry skin. Answer: A. Prolonged menstrual bleeding. Rationale: prolonged menstrual bleeding, A, is a common sign of von Willebrand disease due to impaired clotting. Headaches, B, fatigue, C, and dry skin, D, are not specific to this condition. 123. A patient with chronic lymphocytic leukemia is prescribed prednisone. What should the nurse monitor? A. Blood glucose levels. B. Platelet count. C. Blood pressure. D. Respiratory rate. Answer: A. Blood glucose levels. Rationale: prednisone can cause hyperglycemia, so monitoring blood glucose levels, A, is critical. Platelet count, B, blood pressure, C, and respiratory rate, D, are not primary concerns with prednisone. 124. A nurse is caring for a patient with a history of blood transfusions. Which symptom indicates iron overload? A. Darkened skin. B. Increased appetite. C. Fever. D. Weight loss. Answer: A. Darkened skin. Rationale: iron overload from frequent transfusions can cause darkened skin, A, due to hemosiderin deposition. Increased appetite, B, fever, C, and weight loss, D, are not typical signs of iron overload. 125. A patient with thrombocytopenia is at risk for bleeding. Which intervention is most appropriate? A. Encourage vigorous oral hygiene. B. Use a soft bristled toothbrush. C. Allow unrestricted ambulation. D. Apply heat to bruised areas. Answer: B. Use a soft bristled toothbrush. Rationale: a soft bristled toothbrush, B, prevents gingival bleeding in thrombocytopenia. Vigorous oral hygiene, A, increases bleeding risk. Unrestricted ambulation, C, risks injury. Heat, D, worsens bruising. 126. A patient with sickle cell anemia is experiencing a vaso-occlusive crisis. Which intervention is most effective? A. Apply a heating pad. B. Administer 4 fluids. C. Restrict oral intake. D. Encourage vigorous exercise. Answer: B. Administer 4 fluids. Rationale: 4 fluids, B, reduce blood viscosity and promote circulation, helping to alleviate a vaso-occlusive crisis in sickle cell anemia. Heating pads, A, may worsen vaso-occlusion. Restricting oral intake, C, is contraindicated as hydration is critical. Vigorous exercise, D, increases oxygen demand and may exacerbate the crisis. 127. A nurse is monitoring a patient receiving warfarin. Which lab result indicates a therapeutic level? A. INR of 2.5. B. APTT of 60 seconds. C. Platelet count of 150,000/mm superscript 3. D. Hemoglobin of 12G/DL. Answer: A. INR of 2.5. Rationale: a therapeutic INR for warfarin is typically 2.0 to 3.0, A, indicating effective anticoagulation. APTT, B, monitors heparin. Platelet count, C, and hemoglobin, D, are not specific to warfarin therapy. 128. A patient with pernicious anemia is prescribed cyanocobalamin. What should the nurse teach the patient? A. Expect lifelong therapy. B. Take orally with meals. C. Discontinue after 1 month. D. Avoid vitamin C supplements. Answer: A. Expect lifelong therapy. Rationale: Pernicious anemia requires lifelong cyanocobalamin, vitamin B12, therapy. A. Due to intrinsic factor deficiency. Oral administration, B, is ineffective. Discontinuing after 1 month, C, is incorrect. Vitamin C, D, does not interfere with B12. 129. A nurse is caring for a patient with leukemia who reports bone pain. What is the nurse's best action? A. Encourage weight-bearing exercises. B. Administer prescribed analgesics. C. Apply ice to affected areas. D. Restrict calcium supplements. Answer: B. Administer prescribed analgesics. Rationale: bone pain in leukemia is common due to marrow infiltration, requiring analgesics, B, for relief. Weight-bearing exercises, A, may worsen pain. Ice, C, is less effective for bone pain. Calcium supplements, D, are not contraindicated unless hypercalcemia is present. 130. A patient with a hemoglobin of 6G/DL is scheduled for a blood transfusion. What should the nurse verify before starting? A. Patient's blood type and cross-match. B. Patient's dietary preferences. C. Blood glucose levels. D. Respiratory rate. Answer: A. Patient's blood type and cross-match. Rationale: verifying blood type and cross-match, A, ensures compatibility, preventing transfusion reactions. Dietary preferences, B, blood glucose, C, and respiratory rate, D, are not relevant to transfusion safety. 131. A patient with hemophilia B reports a swollen elbow. What is the nurse's first action? A. Apply a warm compress. B. Administer factor IX. C. Encourage active range of motion. D. Restrict ice application. Answer: B. Administer factor IX. Rationale: a swollen elbow in hemophilia B suggests joint bleeding, requiring factor IX, B, to stop bleeding. Warm compresses, A, worsen bleeding. Active range of motion, C, may increase bleeding. Ice, D, is helpful but secondary to factor replacement. 132. A nurse is caring for a patient with thrombocytopenia. Which precaution is most important? A. Avoid intramuscular injections. B. Encourage vigorous toothbrushing. C. Allow unrestricted ambulation. D. Apply heat to bruised areas. Answer: A. Avoid intramuscular injections. Rationale: thrombocytopenia increases bleeding risk, so avoiding intramuscular injections, A, prevents hematomas. Vigorous toothbrushing, B, may cause gingival bleeding. Unrestricted ambulation, C, risks injury. Heat, D, worsens bruising. 133. A patient with polycythemia vera reports blurred vision. What should the nurse suspect? A. Hyperviscosity. B. Hypoglycemia. C. Dehydration. D. Infection. Answer: A. Hyperviscosity. Rationale: blurred vision in polycythemia vera is likely due to hyperviscosity, A, from increased red blood cells, impairing blood flow. Hypoglycemia, B, dehydration, C, and infection, D, are less likely without specific symptoms. 134. A nurse is teaching a patient with iron deficiency anemia about dietary changes. Which food should the nurse recommend? A. Red meat. B. White bread. C. Milk. D. Bananas. Answer: A. Red meat. Rationale: red meat, A, is high in heme iron, which is easily absorbed and beneficial for iron deficiency anemia. White bread, B, milk, C, and bananas, D, are low in iron. 135. A patient with disseminated intravascular coagulation, DIC, reports epistaxis. What is the nurse's priority action? A. Apply nasal packing. B. Assess vital signs. C. Encourage ambulation. D. Restrict fluid intake. Answer: B. Assess vital signs. Rationale: epistaxis in DIC indicates bleeding, so assessing vital signs, B, evaluates for hemodynamic instability. Nasal packing, A, may be needed but is secondary. Ambulation, C, increases bleeding risk. Fluid restriction, D, is inappropriate as hydration supports circulation. 136. A nurse is caring for a patient with a history of pulmonary embolism. Which medication is most likely prescribed? A. Aspirin. B. Enoxaparin. C. Clopidogrel. D. Iron supplements. Answer: B. Enoxaparin. Rationale: enoxaparin, B, a low molecular weight heparin, is commonly prescribed for pulmonary embolism to prevent further clotting. Aspirin, A, and clopidogrel, C, are antiplatelet agents, not primary for embolism. Iron supplements, D, are unrelated. 137. A patient with sickle cell disease is prescribed hydroxyurea. What should the nurse monitor? A. White blood cell count. B. Blood glucose levels. C. Blood pressure. D. Skin turgor. Answer: A. White blood cell count. Rationale: hydroxyurea can cause myelosuppression, so monitoring white blood cell count, A, is critical to detect neutropenia. Blood glucose, B, blood pressure, C, and skin turgor, D, are not primary concerns with hydroxyurea. 138. A nurse is assessing a patient with suspected aplastic anemia. Which lab result supports this diagnosis? A. Pancytopenia. B. Increased hemoglobin. C. Elevated platelet count. D. Normal white blood cell count. Answer: A. Pancytopenia. Rationale: aplastic anemia causes bone marrow failure, leading to pancytopenia, A. Low red cells, white cells, and platelets. Increased hemoglobin, B, elevated platelets, C, and normal white cell count, D, are inconsistent with aplastic anemia. 139. A patient with multiple myeloma reports constipation. What is the nurse's best action? A. Encourage a high-fiber diet. B. Restrict fluid intake. C. Administer analgesics. D. Apply a warm compress. Answer: A. Encourage a high-fiber diet. Rationale: constipation in multiple myeloma may be due to medications or immobility, so a high-fiber diet, A, promotes bowel regularity. Fluid restriction, B, worsens constipation. Analgesics, C, are not indicated. Warm compresses, D, are ineffective for constipation. 140. A nurse is caring for a patient receiving a blood transfusion. Which action ensures safety? A. Infuse over 6 hours. B. Use a dedicated 4-line. C. Mix with dextrose solution. D. Administer without a filter. Answer: B. Use a dedicated 4-line. Rationale: a dedicated 4-line, B, prevents mixing with other medications, ensuring transfusion safety. Blood is infused over 2 to 4 hours, not 6 hours, A. Dextrose, C, causes hemolysis. A filter, D, is required to remove clots. 141. A patient with iron deficiency anemia reports nausea from iron supplements. What should the nurse suggest? A. Take with meals. B. Stop the supplement. C. Take with milk. D. Increase the dose. Answer: A. Take with meals. Rationale: taking iron supplements with meals, A, reduces nausea, though it may slightly decrease absorption. Stopping the supplement, B, is not advisable without consultation. Milk, C, reduces absorption. Increasing the dose, D, worsens nausea. 142. A nurse is caring for a patient with a history of hemophilia. Which medication should the patient avoid? A. Ibuprofen. B. Acetaminophen. C. Vitamin C. D. Calcium supplements. Answer: A. Ibuprofen. Rationale: ibuprofen, A, inhibits platelet function, increasing bleeding risk in hemophilia. Acetaminophen, B, is safe for pain. Vitamin C, C, and calcium, D, do not affect bleeding. 143. A patient with chronic lymphocytic leukemia reports fatigue. What should the nurse assess first? A. Hemoglobin level. B. Blood glucose. C. Respiratory rate. D. Skin integrity. Answer: A. Hemoglobin level. Rationale: fatigue in chronic lymphocytic leukemia is often due to anemia, so assessing hemoglobin level, A, is the first step. Blood glucose, B, respiratory rate, C, and skin integrity, D, are not directly related to fatigue in this context. 144. A nurse is preparing a patient for a splenectomy due to hemolytic anemia. What is the priority teaching? A. Importance of vaccination. B. Need for a low-iron diet. C. Avoidance of deep breathing. D. Restriction of physical activity. Answer. A. Importance of vaccination. Rationale. Splenectomy increases infection risk, so vaccinations, e.g. pneumococcal, are critical pre-surgery. A low-iron diet, B, is not indicated. Deep breathing, C, prevents complications. Activity restriction, D, is temporary but not the priority. 145. A patient with thrombocytopenia reports a headache. What is the nurse's first action? A. Administer aspirin. B. Assess for neurological changes. C. Encourage ambulation. D. Apply a warm compress. Answer. B. Assess for neurological changes. Rationale. A headache in thrombocytopenia may indicate intracranial bleeding, so assessing for neurological changes, B, is the priority. Aspirin, A, increases bleeding risk. Ambulation, C, is unsafe until bleeding is ruled out. Warm compresses, D, are ineffective. 146. A nurse is caring for a patient with a prolonged PT/INR. Which medication is likely responsible? A. Heparin. B. Warfarin. C. Enoxaparin. D. Aspirin. Answer. B. Warfarin. Rationale. Warfarin B prolongs PT/INR, used to monitor its anticoagulant effect. Heparin A and enoxaparin C affect APTT. Aspirin D affects platelet function, not PT/INR. 147. A patient with sickle cell anemia is admitted with fever and cough. What should the nurse suspect? A. Acute chest syndrome. B. Asthma exacerbation. C. Heart failure. D. Allergic reaction. Answer. A. Acute chest syndrome. Rationale. Fever and cough in sickle cell anemia suggest acute chest syndrome. A serious complication involving pulmonary vaso-occlusion. Asthma, B, heart failure, C, and allergic reactions, D, are less likely without specific symptoms. 148. A nurse is teaching a patient with folate deficiency anemia. Which supplement should the nurse recommend? A. Folic acid. B. Vitamin B12. C. Iron. D. Vitamin D. Answer. A. Folic acid. Rationale. Folic acid, A, corrects folate deficiency anemia. Vitamin B12, B, treats pernicious anemia. Iron, C, is for iron deficiency anemia. Vitamin D, D, is unrelated to anemia. 149. A patient with multiple myeloma is at risk for which complication? A. Renal failure. B. Hypoglycemia. C. Hypertension. D. Osteoarthritis. Answer. A. Renal failure. Rationale. Multiple myeloma can cause renal failure, A, due to hypercalcemia and protein deposition. Hypoglycemia, B, hypertension, C, and osteoarthritis, D, are not primary complications. 150. A nurse is caring for a patient receiving a blood transfusion. Which symptom indicates fluid overload? A. Dyspnea. B. Fever. C. Urticaria. D. Chills. Answer. A. Dyspnea. Rationale. Dyspnea, A, is a sign of fluid overload during a blood transfusion, indicating pulmonary edema. Fever, B, urticaria, C, and chills, D, suggest other transfusion reactions, febrile or allergic. 151. A patient with iron deficiency anemia reports palpitations. What is the nurse's priority action? A. Assess heart rate. B. Encourage vigorous exercise. C. Restrict dietary iron. D. Apply a warm compress. Answer. A. Assess heart rate. Rationale. Palpitations in iron deficiency anemia may indicate tachycardia due to reduced oxygen delivery, so assessing heart rate, A, is the priority. Vigorous exercise, B, is unsafe. Iron restriction, C, worsens anemia. Warm compresses, D, are irrelevant. 152. A nurse is caring for a patient with a history of heparin-induced thrombocytopenia, HIT. Which anticoagulant is safe? A. Enoxaparin. B. Argatroban. C. Heparin. D. Warfarin. Answer: B. Argatroban. Rationale: Argatroban, B, a direct thrombin inhibitor, is safe for HIT. Enoxaparin, A, and heparin, C, are contraindicated due to HIT. Warfarin, D, is not ideal initially due to delayed onset. 153. A patient with sickle cell disease reports abdominal pain. What should the nurse assess first? A. Bowel sounds. B. Blood pressure. C. Skin turgor. D. Joint mobility. Answer: B. Blood pressure. Rationale: abdominal pain in sickle cell disease may indicate vaso-occlusion or organ ischemia, so assessing blood pressure, B, evaluates hemodynamic stability. Bowel sounds, A, skin turgor, C, and joint mobility, D, are secondary. 154. A nurse is teaching a patient with hemophilia about injury prevention. Which instruction is most important? A. Avoid sharp objects. B. Increase dietary sodium. C. Wear loose clothing. D. Limit fluid intake. Answer: A. Avoid sharp objects. Rationale: avoiding sharp objects, A, prevents cuts and bleeding in hemophilia, a critical safety measure. Sodium intake, B, loose clothing, C, and fluid intake, D, are not directly related to injury prevention. 155. A patient with chronic lymphocytic leukemia is prescribed chemotherapy. What is the nurse's priority teaching? A. Monitor for signs of infection. B. Maintain a low-protein diet. C. Avoid deep breathing exercises. D. Increase sun exposure. Answer: A. Monitor for signs of infection. Rationale: chemotherapy causes immunosuppression, increasing infection risk, so monitoring for infection signs, A, is critical. Low-protein diet, B, is not indicated. Deep breathing, C, prevents complications. Sun exposure, D, increases skin damage risk. 156. A nurse is caring for a patient with a platelet count of 25,000/mm superscript 3. Which intervention is most appropriate? A. Encourage contact sports. B. Use an electric razor. C. Apply warm compresses. D. Allow vigorous oral hygiene. Answer: B. Use an electric razor. Rationale: a platelet count of 25,000/mm superscript 3 indicates severe thrombocytopenia, so using an electric razor, B, prevents bleeding from cuts. Contact sports, A, and vigorous oral hygiene, D, increase bleeding risk. Warm compresses, C, worsen bruising. 157. A patient with pernicious anemia reports difficulty walking. What should the nurse suspect? A. Neuropathy. B. Muscle strain. C. Joint inflammation. D. Dehydration. Answer: A. Neuropathy. Rationale: difficulty walking in pernicious anemia suggests neuropathy, A, due to vitamin B12 deficiency affecting nerves. Muscle strain, B, joint inflammation, C, and dehydration, D, are less likely without specific symptoms. 158. A nurse is monitoring a patient receiving fresh frozen plasma. What is the nurse's priority action? A. Check vital signs frequently. B. Encourage ambulation. C. Restrict fluid intake. D. Apply a warm compress. Answer: A. Check vital signs frequently. Rationale: frequent vital sign checks, A, detect transfusion reactions during fresh frozen plasma administration. Ambulation, B, is not a priority. Fluid restriction, C, is inappropriate. Warm compresses, D, are irrelevant. 159. A patient with polycythemia vera is prescribed low-dose aspirin. What is the purpose of this medication? A. Reduce thrombosis risk. B. Increase red blood cell production. C. Prevent infection. D. Enhance immune response. Answer: A. Reduce thrombosis risk. Rationale: low-dose aspirin, A, reduces thrombosis risk in polycythemia vera by inhibiting platelet aggregation. It does not increase red blood cells, B, prevent infection, C, or enhance immunity, D. 160. A nurse is caring for a patient with a history of deep vein thrombosis. Which symptom requires immediate attention? A. Leg swelling. B. Mild fatigue. C. Dry skin. D. Increased appetite. Answer: A. Leg swelling. Rationale: leg swelling, A, in DVT suggests worsening thrombosis or new clot formation, requiring immediate attention. Fatigue, B, dry skin, C, and increased appetite, D, are not urgent or specific to DVT.